The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing pandemic of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. It was first identified in December 2019 in Wuhan, China. The World Health Organization declared the outbreak a public health emergency of international concern in January 2020 and a pandemic in March 2020. As of December 18, 2020, more than 75.5 million cases have been confirmed, with more than 1.67 million deaths attributed to COVID-19. Symptoms of COVID-19 are highly variable, ranging from none to severe illness. The virus spreads mainly through the air when people are near each other. It leaves an infected person as they breathe, cough, sneeze, or speak and enters another person via their mouth, nose, or eyes. It might also spread via contaminated surfaces. People remain infectious for up to 2 weeks, and can spread the virus even if they do not have symptoms. Recommended preventive measures include social distancing, wearing a face mask in public, ventilation and air filtering, hand washing, covering one's mouth when sneezing or coughing, disinfecting surfaces, and monitoring and self-isolation for people exposed or symptomatic. There are several COVID-19 vaccines in development. Current treatments focus on addressing symptoms while work is underway to develop therapeutic drugs that inhibit the virus. Authorities worldwide have responded by implementing travel restrictions, lockdowns, workplace hazard controls, and facility closures. Many places have also worked to increase testing capacity and trace contacts of the infected. On March 24, 2020, the Centers for Disease Control and Prevention, CDC, of the United States, indicated the World Health Organization, WHO, had provided 2 codes for COVID-19, UO7.1 when confirmed by laboratory testing and UO7.2 for clinically or epidemiological diagnosis where laboratory confirmation is inconclusive or not available. The CDC noted that because laboratory test results are not typically reported on death certificates in the U.S., the National Center for Health Statistics, NCHS, is not planning to implement UO7.2 for mortality statistics and that UO7.1 would be used if the death certificate reports terms such as probable COVID-19 or likely COVID-19. On April 16, 2020, the World Health Organization, WHO, in its formal publication of the 2 codes, UO7.1 and UO7.2, recognized that in many countries detail as to the laboratory confirmation will not be reported, and recommended, for mortality purposes only, to code COVID-19 provisionally to code UO7.1 unless it is stated as probable or suspected. It was also noted that the WHO does not distinguish between infection by SARS-CoV-2 and COVID-19. In August 2020, the WHO reported serology testing for 3 locations in Europe, with some data through 2nd of June, that showed IFR overall estimates converging at approximately 0.5 to 1%. A systematic review article in the BMJ advised that caution is warranted, using serological tests for epidemiological surveillance and called for higher quality studies assessing accuracy with reference to a standard of RT-PCR performed on at least 2 consecutive specimens, and, when feasible, including viral cultures. On October 6, 2020, Dr. Mike Ryan, director of the WHO's Health Emergencies Program, announced our current best estimates tell us that about 10% of the global population may have been infected by this virus. Also in October, the Center for Evidence-Based Medicine, CEBM, reported a presumed estimate of global IFR at between 0.10% to 0.35%, noting that this will vary between populations due to differences in demographics. These researchers noted a decrease in IFR in England over time, and, for the UK and Italy, the 2 European nations worst hit by COVID-19, attribute the rise in daily cases, stability in daily deaths, and shift of cases to a younger population to waning viral circulation, misapplication of testing, and misinterpretation of test results rather than to prevention, treatment, or virus mutation. In November 2020, BioNTech and Pfizer Incorporated, Moderna, the University of Oxford, in collaboration with AstraZeneca, and the Gamaleya Institute announced positive results from interim analyses of their Phase 3 vaccine trials. As of 18th of December, 12 countries have approved the Pfizer-BioNTech COVID-19 vaccine for emergency use. Furthermore, Bahrain gave emergency marketing authorization for the vaccine manufactured by Sinopharm, followed by the United Arab Emirates. By 16th of December, in the United Kingdom, 138,000 people had received the Pfizer-BioNTech COVID-19 vaccine during the first week of their vaccination program.